so next we're going to talk about open source software and free open source software system. With OSS, any programmer can implement, modify, apply, reconstruct, and restructure the rich libraries of source code available from proven, well-tested products. And there is a really good video. It's really long that explains it. Not really long, it's 11 minutes, but it explains it. I'm posting it to our wall so you can get into it a little more. And it's presented looking specifically at medical EMRs, which I just think is pretty important in our line, so I would encourage you to look at it. So interoperability. This is the ability to share information across organizations and remains paramount under the High-Tech Act. The ability to share patient data is extremely important both within an organization and across organizational boundaries. So this is when we're talking about interfacing information.
Memorial Hospital is a community-based hospital. We see over 13,000 inpatients here a year.
We employ 2,600 individuals, have 45 locations, and serve 10 counties.
We're also being continually scrutinized by Medicare, Medicaid, and really appropriately so by all payers who we do business with in terms of providing higher quality at lower cost. So that is the end game, and that end game is going to require efficiency in information systems and integrated technology to deliver that. It's all about being able to provide the right information at the right time so that we can make better decisions, improve outcomes, and really through the technology do it at a lower cost ultimately than we are today.
Our partnership with Philips began because of the need to get the patient monitoring data from the Philips monitors into our EMR, which is Meditech. We utilize the Philips Intelligent Patient Monitors and SureSight Spot Check monitors, which connect to the Intelligent Enterprise, or ABI-E. This sends data to our Meditech system through interfaces and also interfaces with ADT. With Philips, we were able to use barcode scanners on the monitoring devices so that you can actually scan the patient's information at the bedside, obtain the vital sign parameters, and then they go into the medical record. Currently, I think the staff love ABI-E.
Nursing saw the value in what we were doing and saw that it did free up time for them at the bedside.
The troubleshooting tool within ABI-E allows my analysts to go in and figure out where the issue is so that for quicker resolution. And then we also have Philips support available 24/7, so if they get stuck on an issue, they can certainly reach out to the call person who will help walk them through. ABI-E helps us to meet the guidelines for meaningful use by improving the documentation of vital signs.
I'm not even present, but I have all this information there, and that just means that the patient gets the care that they need quickly from the person that's seen them that day. And has now this information available to them. We can correlate data better now than we ever have, and we can look at vital sign information along with lab information, along with radiology information, assimilate that in one place and be able to make better decisions, which ultimately is going to positively impact patient care. It allows the nurse to be monitoring the vital signs in real time as they're happening, but doesn't force them to take the time to record during a procedure or an emergency event. Really, the demands on healthcare are more data-driven than they ever have been. So we have to have quantifiable data to help us make better decisions, not only at the point of care, but also in helping our patients who have chronic illness, for example. What's really at stake is providing the right information at the right time and the right place in order for those decisions to be made faster. And we're able to do that with this technology. Once everybody, all providers that are involved in a patient's care realize that this information is there, available anywhere, anytime to anyone who is involved in the patient's care. Just people love it.
Okay, so that was just a little bit of introduction to interoperability. I think, you know, for any of you who work in Epic and you use Care Everywhere to look at past results, it's really important. I don't know how many of you are outpatient. There are a few of you who are, especially for my mental health people what. I'm not mental health, but I have great respect for the mental health nurses. Continuity of care is so important. And a lot of mental health records aren't shared necessarily within these interoperability interfacing programs. However, it's still a lot easier to get access to than it was before. And that's great. I know for me, when I practice, I have very transient patients. I work, in public health. And so, and I don't think it's anyone's necessarily disloyalty. They don't understand, but they just get care where they can. And so I'll have someone who, 2012, 2013, they were my patient. 2014, they left and went to Tri Health because, say, I referred them to ortho there, and then ortho was like, oh, you need cardiac clearance. I'm going to refer you back to a cardiologist. So I'll send you one at Tri Health, and the cardiologist is like, great, you're doing fine. Why don't you follow up with your PCP? They don't understand what PCP means, so they're like, I don't have one. They send them to a Tri Health PCP, and after a few visits, they're like, oh, this sounds like Denise, my nurse practitioner. I'm going to go back and see her. Meanwhile, that was a whole year. They came back, so there was a whole year missing of their medical life. And even I think I'm a fairly responsible person. It's really hard for me to keep track of everything that happened within the year. And so that interoperability helps connect us. I know it also helps connect to fast-track referrals for consults. For example, somebody comes in with rheumatoid arthritis, and they say to you, you know what, I've been with this rheumatologist for 6 years. The relationship is just not therapeutic anymore. He's getting ready to retire. I need someone who has a more holistic approach. Can you send me to this rheumatologist? And, the referral, of course, has come from me as a PCP. And when you refer to a specialist, oftentimes they want past records. And you're like, okay. Now it's easy. I can access them, I can print them, and I can forward them on. So, again, interoperability is probably, for me, one of the most important aspects when we're talking about the SDLC and software programming within the HITECH Act and our EMR. So the SDLC, the new information can be really overwhelming. It affects outputs from earlier phases. So what happens before is going to affect your next steps. And the development effort needs to be re-examined. We're talking about constant feedback loops or stopped until these modifications can be reconciled and can move forward, which is nice to kind of have those hard and soft stops to give you a second to stop, look at what you're doing and think, am I making things harder and making things easier? Are we doing something just for doing something's sake? So there are times that teams can be really overwhelmed with new ideas from the iterative process. And again, iterative just means the step process, a scientific, systematic step process. And it results in new capabilities or features that exceed maybe the scope of the project. So what's really important as a team leader is you should preserve these ideas or initiatives so they can be considered at a later time. So maybe you, in coming up with a workflow efficiency, also came up with improved motivational interviewing, and you're kind of like, look, hold the phone. Our project was just to improve how quickly we can room somebody, and now you're talking to me about better interviewing. It's just really not the right time for our team. So you take that initiative, those new ideas, and you just put them away, but don't throw them away. So your team should develop a list of recommendations to improve current software when a project is complete and when a project's ongoing. And this is what makes the SDLC robust. So as technology and research continues to advance, the new SDLC models are pioneered and introduced to enhance techniques. Interpretation and implementation of any model selected reflects the knowledge and skill of the team applying the model. And so part of it is, you might say, Denise, I'm never going to do that. But actually getting involved in this programming part of healthcare is super important because we're actually the people that they want on their team, because we're the ones who are going to be the end users. And so getting feedback from us on a regular basis is going to help improve any of your programming that's going to better patient care.